I think we just need to touch on the safety just a little bit because we really haven't. We've spoken about the efficacy and the formulation and really all the amazing attributes, but we should touch on safety. It's also an amazing attribute. It is a PDE4 inhibitor, right? And we know from apremilast, for example, that we can have some systemic side effects. Certainly not to any extent of a systemic drug, but we do see some people have a little bit of GI upset, maybe some diarrhea. What else do we see? Headache in a small percentage of people. Am I missing anything, Peter? I think those are the most common.
Those are the biggies. We saw the
Yeah.
reaction site, and the application site pain or
Yeah.
stinging is very, very low, is like around 1% or less. So we know that's
Mhm.
really good. But yeah, the one I tell my patients about is loose stools,
Okay.
because it's once in a while, and it
Yeah.
really does seem to be part of that pathway. This is a powerful medicine. It's well absorbed, and apparently in our distal colon, some of the water reuptake enzymes rely on PDE4. So if we block that, then you retain a little bit more water in your stool distally, and you'll have a little loose stool. But what I tell my patients is, if you see a little bit of that, usually it's fine. Within a few days, your body will regulate. If there's an issue, you call me, you let me know if it seems too much. But generally speaking, knock on wood, I've never had to stop it because of that.
Yeah. Very mild to moderate at the very most. Usually, if it happens once, it doesn't happen again. And I think in the studies, I don't know if anybody discontinued because of that. If it were, it was very, very low numbers. So, yeah, I think we've got a great overview here, Peter, of the PDE4 inhibitors, kind of the history of them, where we are now with this most modern PDE4 inhibitor with Roflumilast, which again was born from its oral systemic cousin for COPD. So it wasn't a brand new molecule to the body. We knew that it was well tolerated. And now, as a topical, boy, the sky's the limit. And that's just exciting.
It really is. And I think it bodes well for the future of our topicals. They mean so much to me, to both of us. We want people to keep working on them because there are unmet needs. I mean, I wish this worked for everything. It works for a lot of things. And now we have a new tool, but I want to encourage people to see the success of Roflumilast in this context. And hopefully it will inspire other companies not to be afraid of making topicals, but to embrace them and say, hey, this is really important to dermatologists. And boy, this is great for our patients. It helps them in ways that, yes, the new fancy systemics, those are amazing for the more severe patients for sure. But a topical can touch lives, so many more lives, because even the mildest or the most localized disease, we have to start somewhere.
Yeah, and I don't think we're ever going to move away from topicals. I mean, they're just like you said, for that mild to moderate disease where the $10,000 per month biologic is probably not the right way to go. This a really effective, safe, once daily topical with maintenance dosing that has been published is important. And I love what you just said as a call to action for industry. Please don't veer away from topical therapies. I know everyone's so focused on biologics and systemics, and I appreciate that. But we continue to need innovation in topical therapies, much like roflumilast.